Okay, we are live. You want to start, Aaron? Or would you like me to start?
Let me just confirm. Okay, we're
Welcome.
on the YouTube end. Perfect. So, good evening, everyone. Thank you so much for being here this evening. My name is Dr. Aaron Douglas Dotson. I am a resident ophthalmologist at the University of Iowa, PGY3 in Iowa City. It truly is an honor and a pleasure to introduce to you all our inaugural event. We are a part of the National Medical Association's ophthalmology section, and we want to welcome you to this new segment that is called NMA ITV that is here on YouTube Live, where we plan to bring about various relevant eye topics for patients, healthcare providers, anyone who is passionate about learning more with regards to the eye. I have my other co-moderator here, Dr. Daniel LaRoche, and I also have our guest speaker, very distinguished speaker, Dr. Monique Barbour. I want to first give it over to Dr. LaRoche, and then I will introduce our guest speaker, Dr. Barbour. Thank you.
Thank you, Aaron. Welcome, everyone. We're very excited about this inaugural show. The National Medical Association is the oldest organization of African American physicians from 1895, and we are the National Medical Association Ophthalmology Section. And you're going to see board certified eye specialists, experts bringing you information about the eye. And then also we have an interactive opportunity where patients, people of interest, one can come on to ask questions in the chat. And at the end of the presentation, even come on live to ask questions. You must turn your cameras on. We have to see who you are to bring you into the show. If you don't turn your camera on, we cannot bring you into the show. And for those of you that are going to be watching the video upload, please make comments or ask questions in the chat as well. Thank you very much. Welcome, and we'll get started soon. I'll turn it back to you, Aaron.
Excellent. Thank you so much, Dr. LaRoche. And kind of just to keep things in mind, because this is our inaugural event, please be mindful and please be understanding. We look forward to bringing you all additional content within the future. But I definitely do ask, we do have a comments box here if you have any questions or any concerns within the comments, but please be respectful. Otherwise, I can definitely mute you within the comments here. So without further ado, I want to introduce our very distinguished guest, Dr. Monique Barbour. So Dr. Barbour, she is a board certified ophthalmologist. She is a dedicated physician executive with an academic and clinical profile that's fulfilling administrative, academic, and various clinical roles. She graduated with honors from the Howard University College of Medicine, where she completed as well her ophthalmology residency at the Albert Einstein College of Medicine via the Bronx Lebanon Hospital Center. Following her time in residency, she then completed a glaucoma fellowship at Georgetown University in Washington, D.C. She then completed an executive master's degree of health administration from the Florida Atlantic University. She currently serves as the medical director of the Clearview Eye Center in Lake Worth, Florida, where she practices comprehensive ophthalmology and participates in many different clinical trials. She's additionally the founder and CEO of a nonprofit organization that is called the Smiles and Vision Foundation, which tackles various healthcare disparities in education. Dr. Barbour is someone that I personally look up to and aspire to become as influential within the future. We look forward to hearing more from her this evening. Without any further ado, Dr. Barbour, take it away.
Thank you so much, Aaron and Daniel LaRoche, two of my favorite ophthalmology people. I am Dr. Monique Barbour, and I am practicing ophthalmology here in South Florida, where I've been for the past 15 years. Throughout the day, I've seen many, many patients who suffer with dry eye disease, and so I have become somewhat of a dry eye specialist. Lately, we've seen a hot topic, and that is the problem that we're seeing with dry eye patients who are ordering artificial tears either online or those patients who are in nursing facilities who are receiving dry eye medications through various distributors. There has been an outbreak, as a matter of fact, of infectious eye diseases that were, matter of fact, the cause of blindness in many cases, and even one case of reported death from these tainted eye drops. This evening, Thank you so much for your attention. We will be exploring all of the problems with the distribution of these eye drops. We'll talk a little bit about dry eye disease, what the standard of care is for dry eye disease, and how to properly use eye drops and how to properly find the safest products on the market, including reducing your risk of infection when using eye drops. So let us get started by watching a quick video. And let me bring this up. There we go. And I'm having a technical issue. I'm not able to advance to the next slide. Oh, let's try this. Present. Okay, and let me go back. So Aaron, I may need your help on this, whereby I need to go to the next slide. Let's take a look at that. Yeah, it's not advancing. So let me go back. Okay, let me try that one more time to
While you're sorting that out, basically, for those, okay, you got it? All right, good.
This is a short video that recaps the issue of Esri Care artificial tears. Okay, so just to recap again, we're going to speak about the problem with the distribution of an artificial tear product that was manufactured, in fact, by a company called Global Pharma, which is in India. This company then used a distribution model to place the product into the hands of caregivers and patients worldwide. The distribution was through two companies, as a matter of fact, Esri Pharma and Delsam Pharma. So those two companies were responsible for packaging this artificial tear product and distributing this product around the country. As we go through the slide deck, we will talk about dry eye disease, dry eye therapy, and then we'll get into the nuts and bolts of looking at the contaminated product itself, the timeline, and the case reports that occurred, the type of infection that we were seeing, and then we'll shift gears and talk about preventative measures and standard of care treatment for dry eye disease. At the end, we'll close, or open rather, to questions and summarize all of our topics. So first of all, what is dry eye disease? Well, it is the $4 billion question. It is a very, very common condition, and it occurs when your tears are just not able to be produced with the frequency that is expected, or you're not able to keep your eyes lubricated, or the tears that you do produce are evaporating too quickly. What are the symptoms of dry eye disease? Well, patients will complain commonly of just a dry sensation. They may feel that there's something in the eye, but on examination, there's nothing to be found. The eyes may feel gritty, or quite often, patients experience a burning sensation. At times, we do see children who are not able to express their eye discomfort. Rather, they are showing signs of dry eye through their behaviors, such as constant blinking or rubbing their eyes. The eyes can also appear red, Another common symptom that we hear is that the patient will complain of teary eyes or that their eyes are watery. They may also have mucus in their eyes, or their eyes may feel glued shut, especially after sleeping. A lot of our patients who are on the computer for long periods of time may complain of eye strain. Itching is also another common symptom, as well as light sensitivity. How do we treat dry eye disease? Well, you might want to purchase artificial tears over the counter. And we have so many brands and so many artificial tear products. It can be confusing at times. Topical immune modulators. These are medications that are given to patients only by prescription. And you may have heard of some of these kinds of drops, and we'll talk about those later. Oral medications can also be prescribed. Sometimes we recommend omega 3s. Also, we have a treatment that allows heat to be applied to the eyelids. This can sometimes help the glands produce more tears and prevent evaporation of the natural tear that is on the ocular surface. So, as I mentioned, we have a plethora of brands of artificial tear products over the counter that you can purchase. And you can see examples of those here in this slide, such as Refresh or Sustain. There's also TheraTears. There's a new product that has come onto the market called Ivisia. Retain is another product. But these products are basically used to replace your natural tear, rather. They're usually topical eye drops or an ointment. They're dosed 2 to 4 times a day. Again, you can purchase these products without a prescription, and they pretty much replace or attempt to replace the natural tear that protects the eye. Common ingredients that we find in these products are glycerin, methylcellulose, polysorbate, to name a few. The drops can be preserved or non-preserved. And I usually recommend, if you're going to purchase artificial tears, that you look for the most popular brands from companies such as Alcon. And preservative-free is a key word that you need to look at on most labels when purchasing artificial tears. The topical immune modulators. And why do we need something like this? At times, dry eye disease can be inflammatory. And how do we stop the inflammation? The inflammation is stopped by using a product that can break the cycle of inflammation. Right now, we have 3 main immune modulator products on the market. We have Restasis, which came out about 20 years ago. Actually, 2003 is when Restasis came on the market. And this is a product that has cyclosporin A, 0.05%. Restasis is dosed twice a day. It is a medication that is used chronically because dry eye disease is a chronic condition. Once you stop these medications, your dry eye symptoms may come back. Most people get relief from Restasis within the first month or 2. And actually, their vision can improve and their symptoms can improve certainly within 4 to 6 months. The next product that came on the dry eye market was Lifetigras or Xiidra. And you'll see that product pictured here on the top right side of the slide. Xiidra has been on the market since 2016, and it's a little bit different from cyclosporin in that it contains Lifetigras. The problem with Xiidra is that it's a great drug. It works fantastic for dry eye disease, but most patients do complain at some point while using Xiidra that they have pain on installation of the medication. Also, Xiidra is associated with a slight aftertaste. So I always caution my patients that although Xiidra works extremely well for dry eye disease, it can reverse any kind of inflammation on the ocular surface it is not without adverse events. So keep that in mind. The latest drug to hit the market is called Cequa, or cyclosporin A, 0.09%. And Cequa came on the market in 2018, but it actually was not distributed until about 2019. So it's been out there for about 3 years. Xiidra and Restasis have been out there longer, but Cequa now has come with the same product, which is the cyclosporin A, but the technology behind the delivery of the Cequa molecule is a little bit different. This Cequa product is delivered to the ocular tissues through a new technology that helps the molecule to stay active as it reaches the targeted tissue on the ocular surface. And keeping that in mind, Cequa is able to alleviate some of the dry eye symptoms a lot faster than Xiidra or Restasis can. Cequa is dosed twice a day also, and it is available only through prescription. These 3 drugs are only available through prescriptions through your ophthalmologist. So let's take a look at the oral supplements. We have always known that fatty acids help with dry eye disease. Omega-3 fatty acids come highly recommended, but not all omega-3 fatty acid supplements are the same. What you have to look at is the amount of the EPA, and these are the fatty acids that are most important, EPA and DHA. These 2 components have the most helpful benefits, and they're most important in controlling inflammation, believe it or not, as it relates to dry eye disease. The ratio of EPA to DHA may be most beneficial, and you really do have to read the labels. Other oral supplements that we may use at time are vitamin A, vitamin B2, vitamin B6, and B12 is also extremely important for lubricating the ocular surface. If you don't like taking supplements, you can consider taking a gummy, perhaps, or just increase your diet of fish. And if you're not a fish eater, or if you're vegan, you can take flaxseed oil or flax seeds and sprinkle them on your salad or yogurt to increase your omega-3 intake. Sardines also are very, very important and high in content of omega-3 fatty acids. Thermal pulsation is another way that we treat dry eye disease. As I mentioned earlier, we have devices that can heat up the eyelids and subsequently unblock the glands, which may be keeping your ocular surface from staying balanced. So it's a little bit more aggressive treatment. Some of the examples of those kinds of treatments are LipiFlow or Tear Care or Sustain Eye Lux. Either one of those treatments involve a heat-related transfer, which allow the meibomian glands to work much better and more efficiently. So let's move on and talk about what happened with the Esri Pharma dry eye disease case. Well, patients were using the products as early as May 2022 and possibly earlier during 2021, when, of course, we were all getting used to being on Zoom and being online and overuse of our digital devices. Of course, we would develop some type of dry eye disease. As it turns out, the first reported case of a problem with the eye infections that were not clearing with our routine antibiotic drops, the first cases were reported in Los Angeles, and this occurred in May 2020, where an ophthalmologist saw a patient who had an unusual infection. This patient went on to be seen at a hospital in Los Angeles, where the cultures were taken, and the cultures turned out to show a very resistant infection. Later on, during the summer, a cluster of cases then started to appear in Connecticut, Utah, and Texas. So from July 2022 to October 2022, there were about 20 plus cases that appeared in the literature, and the CDC took notice of that. In November 2022, a nursing home reported an outbreak of pink eye, and they began to investigate this along with the CDC. And they found out that there were several patients in the nursing home. And of course, the patients were of, an older age. So this was an older population that was already at risk for pneumonia and pulmonary diseases. One patient, an 83-year-old male, actually died of sepsis. The workup and the investigation led to the fact that the patient had been using the Esri Care artificial tears, which may have led to this sepsis and pneumonia, and the patient later died. So up to this point, patients were either losing their vision, having infections that did not respond to the usual topical antibiotic therapy, and the cases were reported appropriately to the CDC, and through all the hard work of everyone behind the scenes, they narrowed it down to the Esri Care artificial tear. In Florida, and I believe these were some of the cases that occurred later in the year in 2022, at Bascom Palmer University, an ophthalmologist reported a case, notified the CDC. From that point, the ball started rolling, and the rare strain was identified, which led to the recall of the Esri Care artificial tears, which occurred in February 2023. At this point, if you visit the FDA website or the CDC website, you can see the timeline of how this all unfolded, and you can see what's the latest information as far as these cases go. My position here is to report to all of you that you must be judicious when purchasing artificial tear products over the counter, and pay particular attention to the brand that you may be purchasing, and take a look at the history and the timeline, and keeping all of this in mind to exercise judiciously your choice when choosing artificial tears. So what exactly happened? Well, what kind of bacteria was this? In medical school, we learn about all kinds of organisms, and one of them in particular stands out, and it's called Pseudomonas, as a matter of fact. Pseudomonas is a very, very virulent bacteria that is responsible for all kinds of infections. And over 68 cases were reported up to March 2023. So we're talking about a couple of months ago. 11 states, and as a matter of fact, 25 nursing home patients that were housed in a facility in Connecticut exhibited an outbreak of this disease. This strain of Pseudomonas, and as you can imagine, there are many, many strains of this bacteria. The strain was very specific and was found to be resistant to just about every antibiotic that was tried. Patients presented with heavy yellow pus coming out of their eyes, something that had to be very upsetting to both the patients, their families, and to us as physicians who are taking care of this kind of case. Patients were also presenting with complete loss of vision, or within a short amount of time in trying to treat this disease, they went on to suffer complete loss of vision, some of them bilaterally. Again, cases reported in Connecticut, Florida, Utah, and all of the work and investigation behind the scene led to the Esri brand. Esri actually is a pharmaceutical company in New Jersey, believe it or not. Again, the product came from Global Pharma, which is based in India. So the product was produced at the Global Pharma headquarters in India and then packaged and shipped for distribution, where Esri and Delsam pharmaceutical companies got involved. And so they distributed this product to these various nursing homes and other facilities. And I believe that you could have also purchased Esri artificial tears on Amazon, for example, or at your local pharmacy. The only drug that this Pseudomonas resistant strand was found to respond to was in patients that were able to receive the drug intravenously, a drug called Cifetracol. And that is the only drug that has been shown to be effective against this particular strain of Pseudomonas. So now that you see what happened and how this has happened, again, I reiterate the fact that we do have to exercise caution. You are now aware that infections may occur with the use of eye drops. And right now, what we're going to focus on is how to prevent something like this from happening. Well, first of all, you should know that you should only use sterile medications when it comes to your eyes. Avoid contamination of your eye drops by placing them in a safe and dry environment. Simply do not use Esri brand products. If you see that product, definitely do not purchase it. Do not entertain using it for yourself or for your family. If you are using drops and your eyes are worsening and not improving, you should seek professional care immediately. Report any unusual symptoms or cases. If you're not responding, report that to your physicians, and subsequently it should be reported to the Center for Disease Control. As you can see, many other brands are on voluntary recall. Again, there's the top story, the Global Pharma story. They issued a voluntary recall, and that was at the end of February. But as you can see from this list, the FDA has many other reports of patients having serious adverse events, as well as potential risk of injury and infection from other eye drops that are there. So you can check the FDA website or the CDC websites regularly to make sure you are not making the wrong choice when it comes to your eye care. And here are 10 tips for avoiding eye infections. First and foremost, hand washing. This is not overrated. Wash your hands regularly, especially when it comes to picking up drops and handling eye drops that you're going to put anywhere close to your eyes. Also, it's very important to avoid rubbing your eyes. I know that can be very difficult when you go to put eye drops in. Occasionally, you might pry your eyelids open, but it's very important to focus on voluntarily opening your eyes wide enough so that the drop can be instilled properly without perhaps touching your eyelids. If you're a contact lens wearer, make sure that your contact lenses are kept safe and in clean storage solutions. Make sure your contact lenses are clean before putting them into your eyes. Don't sleep with your contact lenses on. I know I've seen quite a few patients in the past who admit to telling me that they have slept in their contact lenses. And guess what? They are putting themselves at risk for ulceration of the cornea. So please remove your contact lenses before you go to sleep. Put them in a clean place where you know that the storage solution is clean. Make sure that you dispose of and you replace old contact lenses as directed. Your contact lenses can pick up particles, and if you're using eye drops on top of your contact lenses, you may be at risk for having deposits on your contact lenses. So dispose of your old contact lenses and make sure you're using fresh contact lenses when able. Also, if you are swimming, right now it's summertime and people may be swimming in freshwater lakes or rivers, and putting yourself at risk for infections. Make sure you flush your eyes thoroughly after swimming, and making sure that you don't have exposure to any kind of bacteria. Never share your makeup brushes or your mascara. And that is a tip that shouldn't be taken too lightly. I know that us as women, especially when we are getting made up, we may want to, or we may have forgotten certain components of our makeup. And it's very tempting to share uh, makeup, lipstick, mascara, eyeshadow, but make sure you aren't putting yourself at risk by sharing these things. Minimize your exposure to mold and other allergens. It is coming off the cusp of allergy season, for example. So make sure if you're prone to allergic eye disease that you minimize your risk of that. Make sure that you seal your eye drop containers very tightly as well. Never store your eye drops without the cover. Some of the eye drops that we see are packaged in a way that they come with a small, what we call dropperette, and you can just tear the top off and instill the drops. So once you're done with that dropperette, you should discard it. Okay, so that is the best way. And of course, you have a whole box of other dropperettes. You can start with a fresh one. Again, store your drops in a dry environment and make sure you are not putting them, let's say, for example, on the kitchen counter where you may be exposing the eye drops to food particles and other dust. So let's time out and discuss a real patient that we may encounter, or you may be the patient. For example, we have a 56-year-old patient who was on multiple eye drops due to glaucoma, and the patient also has a history of cataracts. And if I could see your hands out there, I would ask, what do you think is the best approach for this patient? So while I give you just a second to think about that, I want you to know that I am also a glaucoma specialist. So I see quite a number of patients that are on multiple eye drops, of course, and they also have dry eye disease, and they may have a history of cataracts. What I would consider for this patient is probably a, a method or a way to reduce the number of eye drops that the patient has to take. How do we do that? How do we overcome a situation where a patient will have probably 4 drops, I would say, just to treat glaucoma, and they also are suffering with discomfort because their eyes are dry, probably from some of the preservatives that may be in the glaucoma medications. So, how do we get over that situation? Well, at this time, we may consider for a patient like that a kind of surgery, in fact, that can reduce the number of drops and help them see better by planning a kind of surgery whereby we would remove the cataract and also implant either a small device, which we now call MIGS or micro-incision glaucoma surgical devices, that would improve the pressure of the eye at the same time. And I can tell you that I've had a lot of success, and so has Dr. LaRoche and Dr. Dodson, with combining these techniques and having the patient see better and actually not have to use drops at all, or potentially only having to use one eye drop to control their pressure. This has created a wonderful outcome, and it improves the patient's quality of life in a way that we as physicians may not understand at times, but we've been told by our patients that are very grateful that it improved their quality of life. They're able to see better. They're able to function better at their jobs or their hobbies because they are not having the burden of putting in eye drops all day long. So to summarize, we've talked about a lot here, and I know it's quite a bit of information. And again, we are here to answer your questions, which we'll get to very shortly. The main issue here is that the Esri Care artificial tears, which I have a picture of here on your right, these drops have been recalled due to life-threatening and sight-threatening bacterial infections. Bottom line, do not use this brand of artificial tears, okay? Seek immediate care if your eyes are worsening from the use of any kind of eye drops. And with that, I will now ask if we have any questions, and let me stop sharing my screen and see what the feedback is. There we go.
Thank you, Dr. Barbour, for that excellent presentation and excellent review. That was great. Let's put the link, Aaron, in the feed in case we have anybody that wants to join. There was one question where someone asked, how can you tell the difference between, like, allergy and itchy red eyes and a more serious type of infection with this particular product that could occur if it's a contaminated eye drop? I mean, if I have itchy red eyes, should I be concerned? That was one of the questions that came up.
Okay. I think that's an excellent question. And that's a question that we as physicians always ask ourselves. How are we going to tell the difference? What's our differential diagnosis? As a matter of fact, what we do in the office is use some tests that help us figure things out. But the most important aspect of the examination is the microscopic examination of the ocular tissue, which we see under our slit lamps. For the most part, if the patient only has an allergic disorder, they may present with itching, of course, a watery discharge, and the eyes might become red as well. On the other side, if there is an infection, the patient may present with a frank discharge of yellow pus coming out of the eye. And they may also have a swollen lymph node in front of the ear. So these are other signs that we can see when the patient has a frank infection from a bacteria or a virus. They may be experiencing pain as well as a fever.
Great. Also, you were mentioning cataract and glaucoma. I have my approach to glaucoma, because as people get older, there's an increased prevalence of dryness in the eye. And many of the drops that we use for glaucoma, like you mentioned, can exacerbate and worsen dry eye, cause inflammation, cause redness. And now that cataract surgery is so much safer, I offer cataract surgery very, very early in glaucoma. And with that also, it's so safe. It takes about 10 minutes. People go home the same day and they can get off of eye drops. And like you mentioned, with placing a stent or microinvasive glaucoma surgery, they can really, in one study that we did looking at this, 80% of the patients no longer needed eye drops. So that's a huge advantage, and patients should know about these options for that. There was another question. Someone asked, what about punctal plugs for dry eye? Do you have any comments about punctal plugs for dry eye?
I do. I'm a big fan of punctal plugs, and I tend to use punctal plugs later in my paradigm for dry eye treatment. So the punctal plug is a small collagen device or a device that we put into the eyelid into a structure that's just below the skin or just underneath the skin. And it is a structure that we find in all four of our eyelids that collects the tears that are no longer needed from the ocular surface. So basically, every time you blink, you're flushing tears down the punctum. So what we do is we occlude that opening, and some of these tears can stick around in the ocular surface and provide some of the relief from the dry eye disease that may be experienced. In my treatment approach to dry eye disease, I would usually start the patient on preservative free artificial tears for 1 to 2 weeks and see the patient back and monitor how their dry eye symptoms are improving. If they're not improving or if they're still having dry eye symptoms, I would then move on to a topical immune modulator along with omega 3s. And at some point, the patient may come back still complaining of dry eye disease. And it is at that point that I consider putting punctal plugs. And I usually put the plugs in the lower eyelid of each eye. It's rare that a patient will need to have all four lids plugged, but we do have patients with certain circumstances that warrant the use of plugs on all four lids.
Okay. And then one comment I just wanted to add, because a lot of patients were concerned about how did somebody die from the eye drops. And I just wanted to follow up on some of the things that you mentioned. The Pseudomonas organism is a very toxic organism that makes enzymes that can penetrate the cornea in your eye within hours. So this particular organism can penetrate the cornea of your eye, go inside your body, into your bloodstream in that respect. And so that could make you very sick, particularly if you're older, if your immune system is compromised from cancer or from other disease in that respects. So it's a very rare situation that can occur. And so that's what led to those deaths. And so now taking these products off the market and educating people to be aware of this and making sure they don't sleep with contact lenses, because that can also increase your risk of a Pseudomonas infection. These are all important pearls and takeaways. Aaron, did you have any questions or want to weigh in on anything else over here?
No, I mean, I thought it was a very, very great talk. I actually did a morning rounds presentation for my department at Iowa about the Esricare artificial tears, and it was kind of a fun experience just doing a deep dive into all the investigative journalism and such. And it's interesting because for people who are not involved in medicine, I want for you just to think about this. For an infection like this, it's what we call being multi-drug resistant. Almost everyone here on the call tonight, has taken like amoxicillin. That's more of like a low grade type of antibiotic. When you're talking about a bug that is resistant to carbapenems, that's some of the big game antibiotics, kind of the end of the road. You know that you're messing with a very nasty bug. Actually, the case report that was published at Bascom Palmer, the patient came in on day one with terrible vision, I think like 2200. Within like 2 to 3 days later, they were only hand motion. They were luckily able to save the eye from being enucleated, which is surgical removal of the eye. But I can guarantee you to this day, they're probably still just seeing hand motion. So I'm very passionate about this topic. I look forward to seeing the rest of the investigation about it. And, hopefully we can prevent this from happening within the future and to help save our patients' vision. I got another question in the chat here, actually from Miss Shirley Chapman. Her question was, when washing your face with different soaps or even tap water, does that put you at a risk for eye infections or irritation?
That's a great question. And I think this is something that we all do first thing in the morning. We get in, splash the water, it helps you to wake up. I think that it's better to err on the side of caution when using tap water. And it's great to use it on your face, but perhaps not putting it directly into your eye is the best approach.
That's a good point that was brought up when you mentioned tap water. I have patients that travel internationally, like to Haiti, Jamaica, certain parts of Africa sometimes. And sometimes the tap water is not treated.
Mhm.
And if they have a bleb, or from bleb is like or some scar tissue from previous eye surgery, I tell them to use bottled water when washing their eyes and washing their face, because you don't want to have contaminated water to get in. And sometimes I'm very cautious about certain lakes that may be contaminated, have a lot of bacteria. If they have any risk of eye infection, to be careful not to swim or immerse their head beneath that to reduce the risk of eye infection as well. So that's an interesting point.
Great angle.
Okay, I see Jackie Wright's on in the chat. Hello, Jackie, our administrator and NMA Ophthalmology. Thank you for all you do. I want to give a shout out to Fasica and the NMA leadership team as well. And I think, we're at the 46-minute point. I don't see any other questions in the chat, and no one's come on. I think it's been a great first show. It's been very informative. And we're going to upload this on to the YouTube platform. For those people that watch later, please like the video. Please make some comments. I think we have a couple other questions. Do you want to take the questions, Aaron? We do have a couple more questions that came up.
Yeah, so we have a question from, this looks like Dr. Corley, Whitney Miller Corley. She's an optometrist. What can we say to reassure our patients who are afraid of using any eye drop despite it not being EsriCare? Because as we know in the past, there have been other brands like contact lens solutions that have had outbreaks and stuff. But how can we reassure our patients that, it's okay?
I like that question, and it's something of an issue that I face on a daily basis. And it seems that patients are more and more reluctant to use eye drops. But as eye care professionals, we have to reassure our patients verbally and by demonstrating that the safety is in place. All of the safety factors are there to ensure that the product that they're using is safe and they will not have an issue with the.
Excellent. Thank you. And then there's one additional question down here is there a central location where ophthalmologists or even patients, they can keep track of eye drop recalls, medication recalls? I know that with the EsriCare in particular, it took a few years to kind of put the pieces together to get the ball rolling. But is there anywhere that we can check in just to see, like, okay, this drop has been recalled, I need to be careful?
I think I had one slide that mentioned the FDA website. So as you navigate the FDA website, there is a tab there, and it just simply says recalls, news, or there's a search box that you can just type the word artificial tears and any recall information or alerts will pop up. I think what's more popular now is something called ChatGPT. And I don't know if you guys have been able to use it, but it's all the rage. And if you go to any ChatGPT platform and type in artificial tears, recalls, or alerts, I think that platform will just explode with the information that you might be looking for. So keep that in mind.
Great point. I just got ChatGPT on my phone. I love it when I want to research something up real quick or get some information real quick. So I think that that's it in terms of the questions. I do want to say one other thing. I want to say thanks to those who watched and for your questions. This is our inaugural show. Please help us spread the news. We're going to be bringing experts on to tackle different aspects of eye health and health in general that affect our community, both in the United States, in the Caribbean, and Africa as well. We have a high prevalence of eye disease in these parts of the world with low physician manpower. I'll give you an example. In the United States, we have 26,000 ophthalmologists, but only 400 are African American. And there's 40 million African Americans in the United States. And because of the history of this country, many of these communities are segregated, and there's a shortage of physicians and ophthalmologists that look like us in these communities. For those of you that are younger, we need more African American ophthalmologists and physicians as a whole. Hopefully, we can inspire you to also pursue the career of medicine or the health professions. It's a big need. And we look forward to seeing you in future episodes of NMAI TV. I want to thank Dr. Barbour for coming on. I want to thank Dr. Watson for moderating and helping to set this up. I'll turn it back over to Dr. Dotson.
Awesome. Thank you so much again, Dr. LaRoche. And thank you as well, Dr. Barbour, for taking the time to create this presentation and to help educate our community. To everyone that's tuning in on our NMAI TV YouTube channel, we thank you for being part of this very special inaugural event. We look forward to bringing to you different topics within the future. If there's a particular topic that you're interested in wanting to learn more about or that you want for us to discuss, feel free to comment on it within our videos, or you can even send us a direct message. Thank you all so much, and we look forward to chatting with you soon again.
We'll turn it over to Dr. Barbour. You want to close it out, Dr. Barbour? Any final words?
I just want to reiterate that I'm very gracious tonight and humbled. I'm honored to be here. Thank you so much for allowing me to participate and spread the word to my community.
Great. Awesome. Okay, everyone, have a good night. Thank you.
Good night. Thank you.